Hello and welcome to today's talk. I am Dr. Yamini Ramesh, and today I am going to talk about repertory as a very important tool for every homeopath. So friends, I really like this quote of Dr. J.T. Kant where he says that to learn the materia medica, one must master Hahnemann's organon, after which the symptomatology and a full repertory must be the constant reference books if careful homeopathic prescribing is to be attained and maintained. So, obviously, for any homeopath, organon comes first, then materia medica or symptomatology, and then repertory. But all of these three are tools and pillars of homeopathy. So today I'm going to talk about how to use repertory in better way, how to make rubrics, and how to make it a powerful tool for your practice. So according to me, repertory is very important. So what is the importance of repertory? What are the benefits of it? So first of all, it gives you freedom from prejudice. So when you are actually looking into a repertory for any rubric or symptom, you are actually going beyond what you know already through materia medica or through your memory. So it just frees you from the prejudice. Second thing, it frees you from the prescription of only polychrist remedies, because generally I have seen this, that we can remember few remedies or symptoms of few remedies, and they are mostly polychrist remedies. And also some of our prescriptions are based on our experiences. So if I have treated suppose I have treated constipation with Nux vomica in the past, so I will definitely remember that Nux vomica's constipation for sure for the next patients. So it is possible that I might give Nux vomica only for that particular disease because I cannot remember other symptoms or other remedies. So if I am using repertory, or if anybody is using repertory for that particular symptom or expression of the patient, your prescription can be beyond polychrist remedies or known remedies, I would say. So it helps you to form questions also during case taking. So suppose you are doing a repertorization for a particular case and some remedy is coming up. So just to confirm that remedy or go beyond that remedy, you have to ask the questions related to that particular drug or more questions to confirm that particular remedy. So it also helps you to form questions. It helps you to prescribe unknown drugs, which we often call rare remedies, where you haven't read the materia medica. You can understand the materia medica in detailed way through repertory also. So there are many benefits of repertory. For using repertory, what you need to know? So first of all, you have to know the structure of the repertory. There are many commonly used repertories like Kant repertory, Bonninghausen's repertory, complete repertory, Phatak's repertory. So you have to know the structure of different repertories to use it. You have to know the use of rubrics as well, and how to convert patient's language into rubric. That's very important, that we should know that how to convert the patient's language into rubric. Repertorization based on evaluation is also very important, and differentiation between the remedies. The most important thing in repertorization according to me is rubric making, because many students find it very difficult to convert patient's language into rubric. So we'll be talking about this a little bit. So how to convert patient's language into rubric? So my suggestions here are: get familiar. So you have to know the repertory in and out. So you have to read the repertory, read the rubrics, continuously understand the meaning, find the meaning on Google or in dictionaries or anywhere where the translations are given. So get familiar with the repertory. Without getting familiar, it is very, very difficult to find out the exact rubric or convert patient's language into rubric. Second suggestion is know the rubric. I mean to say that you have to understand the meaning of that particular rubric in a complete way. What a author wants to say or wants to depict through the rubric. So you have to know the rubric, understand the meaning of the rubric. And my final suggestion for this is what I used to do in my college days or even now, that read at least 10 rubrics a day, learn about them, how to use them, what is the meaning of that particular rubric, and also the sub rubrics of those 10 rubrics. If you do this daily along with reading Materia Medica and Organon, it will definitely help you in a longer way. Friends, I have also taken some examples to make you understand what I am trying to say here. So if patient says, doctor, I have pain in my right shoulder, for example, we have taken this. So if he says he has pain in right shoulder, how will you look into a repertory? So what we are going to do is go to a particular anatomical section. All of you know that most of the repertories, not all, but most of the repertories are based on anatomical sections like mind, head, vision, ear, like this. So if you want to see the pain in right shoulder, it will definitely come in the extremities chapter. So I have used complete repertory here for examples. So I would go to the extremities chapter, then shoulders, and then right. So the rubric will be extremities, shoulders, right. So it can be a pain in shoulder, it can be anything in the shoulder, but it is for sure extremities, shoulders, right. You can also take pain in right side. Like this, one patient comes and she says that my periods are very irregular, the menses are irregular and they are like this since starting. What will you do? So the most probable rubric for this kind of expression could be menses. So you have to go into a menses chapter. Delayed, the word is delayed. She said it is very irregular since starting and late. So menses, delayed since starting, or menses delayed in girls first. So we are not taking here menarche because we won't find this directly into our repertory, but we can take menses delayed in girls first. So the first menses was delayed. If your patient is very impatient and doesn't wait at all, there are many patients who constantly ask you, can we come in, we can't wait, you have to give us the appointment on time, like this. So if your patient is very impatient, you can take this rubric, mind, impatience. So impatience is an expression of a mind, so you have to go into a mind chapter and just find out this rubric, impatience. And also there is sub rubric, wait cannot. So I have taken both of them together. Suppose a patient comes and says that, doctor, I'm fed up with the disease, I cannot wait enough now, this is it, please cure me faster, give me something which will help me in a fast way, mujhe theek kar do. What will you take? You have to take, so this is also a mind's expression, okay. So like this, like in this way you have to think that where it can come from or where I have to look. So for this rubric you have to go into a mind section and the rubric is carry desire to be fast. So he wants to get better very fast. carried desires to be fast. If someone says, I have cough is more while brushing. Whenever I brush, I will have more cough. So you can directly go to the chapter cough, and there's a rubric called brushing, cleaning teeth, and 7 remedies are into this rubric. I had this patient, this is my personal experience with one patient, and this was a very unusual thing for me. So this lady came, and she said that whenever I don't feel like talking to anyone, and if someone is coming and talking to me unnecessarily, I would pretend to write or read. I will just pick up a book or notebook and I'll start writing so that they go away. So I was wondering what to take, avoiding, escaping. So I just tried searching this rubric directly into the repertory, and I was searching writing, any rubric from writing. So I went there, mine writing pretends to be. So I got this exact rubric. I didn't know this when I was using the repertory, but I just went there and read all the sub rubrics in writing, and I got this rubric, and there was only one remedy into this rubric. If you have a patient who tries to avoid the situations and also run away from them, so the word for this is escape. The person who wants to just avoid the situation, so you can take this rubric, mind, escape, desire to. Now I have taken some case examples for you to show you how to take all the rubrics together. So this case is of a female aged 45 years. She has a headache, very intermittent headache, mostly on forehead, and when I took the case, she told me that it's aggravated before sleep, in night, in sun, and in morning also. And I asked then how you get the relief. So she said that whenever I roll my head from here to there, rolling head gives me a lot of relief. She is very sensitive to cold air and weather, and she has one more problem, that is palpitations she feels whenever she is sleeping or once she goes for sleeping, like when lying down. So palpitations on and off, and sometimes she is not able to sleep because of these palpitations. And she said, I don't like anyone interfering into my work. I like being independent. I'm this, I'm that. And she was talking a lot about herself. So this was the case. So now we'll see that how to take this whole symptomatology into rubrics. So see how to convert it into rubrics. So first is, she said I have an intermittent headache, which is a chief complaint, and the location is forehead. So if you go into head chapter, there you will get pain as a rubric, as a chief rubric, and headache as a sub rubric. So head, pain, headache, and forehead. This 848 is the number of remedies it has in its in this rubric. Then few other symptoms also. So head, pain, headache, sleep before, like she said that headache is much more before sleep and in the night. So head, pain, headache, rolling head amelioration, that is what she said. Now when I roll my head, it gives me a lot of relief. Head pain, night aggravation, and she is very sensitive to cold air. So chilliness, headache during, and she has this palpitations due after sleep, and she feels this dhar in chest. So I took chest, sleep after, and she was talking a lot about herself, that I'm this, I'm that, and I somewhere I felt that she's boasting herself. She's talking about herself only. So there is a rubric called mind boaster braggart. Okay, so you can take this rubric, boaster. And also there was a cross reference of haughty and pride, so I took both of them together. And now if you see this chart, can you see a remedy? So on first number, I got agaricus as a remedy, which is covering everything, all the rubrics. So I was very happy with that. Generally, we give common remedies for headache, bryonia, natrum, mure, nux vomica, or other remedies also. If we don't know the use of repertory, or we don't go into depth of the patient, so only on basis of repertory I could prescribe a remedy like agaricus, which is completely unusual for this type of complaint. Of course, it's a common remedy, but that's why what I said in starting, that repertory frees you from the prejudice. So I tried the same thing from Kent's repertory also, and got the same result. So even if you are changing the repertory, you can get different results, but generally you also can get same remedy with same type of rubrics. So that was case 1. Now we have a case 2. In this case, this 2 years baby came to me, female, and she had a lot of cough and vomiting. Cough started after going outside. Her mother said that we went to Gujarat for 2 days, and then this cough started. And this baby is very sensitive to cold air and cold weather. She vomits the food as soon as she eats anything. So mother said that she's not eating anything at all. As soon as she eats, she would vomit. So nothing is in her stomach. Cough is very violent. I could see that. Vomiting happens almost every time she eats anything. So that was a very acute case for me. She had almost 7 to 8 vomitings when she came to me in 2 days, and the cough was very violent. So what I did is, I took all these rubrics: stomach vomiting during cough, vomiting during eating after. So vomiting during cough and after eating, both. So this is a combined rubric. I took vomiting in children, cough, air, cold aggravation, and mother also told me that she likes to go in open air. So I also took that cough, air, open amelioration and aggravation both, because they went outside and she was playing outside. So we exactly didn't know, though she likes to go outside, but she has problem with that cold air. And also here in this particular case, I used 2 repertories together. One is a complete repertory 2013, and second is a Phatak repertory, because Phatak repertory is a very useful repertory for if you're getting particulars in the case. So I took cough vomiting with from Phatak, and cough eating after, cough violent, and cough in children. So let's see the result. So when I took this whole set of rubrics, I got bryonia as first choice. So when I got bryonia, and can you see ipecac is also covering everything except cough eating after. So I was a little confused, because I didn't get that many symptoms which I was expecting, and it was a very violent acute episode of cough. So through this repertory, I asked a question to the mother to just confirm that whether it is bryonia or ipecac. I asked her that is she thirsty, is your child thirsty? So mom said yeah, she is very thirsty, and she drinks lots of water during cough. She says the throat is dry. So this girl was saying that my throat is dry, and I was very sure of bryonia, because bryonia has a lot of thirst, immense thirst, and I prescribed bryonia, and she got better within 1 day. So that's how repertory helps you to form questions, to go beyond what you know, and it's a transformational tool for a good practice. So from my side, there are some tips for understanding repertory. First is, of course, keep using repertory. Don't fear that you would falter. Keep using it, you will definitely learn it. Keep reading at least 10 rubrics from different sections of repertory. So that is what I said, get familiar with it. Look for cross references. So in one case, like I showed you that I took haughty and pride along with braggart. So you can look for the cross reference and you can learn in that way. Read the sub rubrics also. So whenever I'm using a chief rubric, main rubric, I would definitely read the sub rubrics, even if that is not applicable for my case. In this way I can increase my knowledge of sub rubrics and using the rubric. Also you can note down new sub rubrics to remember them. You can note down in your notepad in the computer. You can make some notebook and just cross check the rubrics from proving or materia medica pura if you want to be 200-300% sure about your final remedy. You can cross check the rubrics. Also, case exercises plays very important role in learning the use of repertory. So you can keep doing cases from your practice, from old books, old masters, from your teacher's practice, from anywhere, wherever you get some symptom or full case, you just try to go through repertory and find out the rubrics and do some case exercises. It will be very beneficial for you. They make you equipped to understand the whole process of repertorization and also the evaluation part. So when suppose you're taking 10 rubrics and your remedy is covering suppose 5 rubrics or 6 rubrics, you have to know that which part you can ignore and which rubric is your main rubric. You have to evaluate like this. So evaluation of symptoms or rubrics is also very important because it tells you how much you can rely on your repertorization. Also I want to tell you how to search peculiar. Suppose if you get some peculiar symptom, very particular, which you don't know whether it exists or not, where to find out. So first you have to understand what is peculiar symptom. So peculiar symptom is something or that symptom which is completely unexpected, so completely out of box in terms of magnitude, direction or amount. For example, you can see burning relieved by heat. So this is completely unexpected. This is a peculiar symptom. Or pain relieved by lying on painful part. Generally, pain is not relieved by lying on painful part. This is a general conception. But for a homeopath, it's very important to ask, to know exactly how the patient is getting relief. Cough relieved by cold water is also a very unusual and peculiar symptom. So you have to search these type of expressions in repertory, and you can also take help of books or softwares to search these type of peculiars. So guys, for today's talk, the learning is how to convert patient's expression into rubric, how to find peculiars, and importance of case exercises. These 3 points I wanted to convey to you. I hope you enjoyed this video. Let me know how did you find it, and also you're most welcome for your all queries. Thank you so much. As Dr. P. Schmidt's quotes, no one can know everything, and this is why in all honesty one must admit that no conscientious homeopathic doctor can practice homeopathy in a serious and really scientific way without a repertory. So repertory is one of the greatest tool we have. Thank you so much. You can write to me on this email rjyamini@gmail.com. Thanks a lot.